All right, welcome back, everybody. Brian Schwager here, founder of Wellness Movement Services, here to present Part 5C in my presentation series, an integrated and holistic approach to relieving lower back pain. Now, in this last part, it may be a little long because I want to kind of expand on the movement as medicine part and the whole corrective therapeutic exercise approach. I won't go into a lot of detail because that's a very specific and can be kind of a complicated topic because there are many variables. But I want to leave you with ideas and an understanding of the importance between manual therapy and passive therapy. I'm going to get into that. That's really something that, in the active therapy perspective, that would be more like the corrective exercise or therapeutic exercise. Manual would be anything hands-on where you're not moving. But the goal is to transition you back into either fitness, athletics, your occupation that may be physical, or for daily activity. And what I have found in my private practice, and even when I was working clinically, for those who were coming around again, they're re-injured. And when I would ask them about, how many different practitioners did you see, and what kind of therapy did you do? It wasn't like they weren't receiving the right physical therapy. It's just that there are phases that are left out that are better suited for transition back into, let's say, the more remedial perspective is daily living, is whatever you're trying to restore has to transfer back out into everyday life. That doesn't include anything else. I want to get back to the tennis court. I want to swing my golf club. I want to get back to the gym, or I want to get back to playing my sport. And to me, those are kind of extremes. But what about just getting back to daily living? Bending, twisting, and pushing a lawnmower and carrying your kids, or um, getting up out of a chair for some people, etc., etc. That usually is what was left on the table because there isn't enough time. A lot of times with physical therapy, there wasn't enough time. I mean, insurance is only going to run you so many weeks. As long as you meet the requirements met by that physical therapy standard, you're released. And like I said, a lot of that stuff gets left on the table. No real fault to the industry itself. No, I shouldn't say that. No real fault to the therapist itself because they're just following the standards and the protocols that they have to. But I have noticed that in the last 10 years, a lot of physical therapy therapists that I've met and I've worked with privately, they went off onto their own privately doing a cash basis, and they have a better program that, that fills this gap. So that's going to be important to cover. So manual versus, active versus passive therapy. Passive therapy is massage. You're just lying down. The minute you get up, things change. Chiropractic. All of these that I utilized in my team approach, my outsource team that I had both in Asheville and Milwaukee, I needed passive therapists to do things that I'm not qualified to do, obviously. But when you pair them up with a comprehensive active therapy approach that also includes lifestyle, we got long-term results. And again, if you're watching this series, then you're wanting to get to the cause. All right, so a little conjecture there, a little add-on there. Let's do a quick review. So what are our learning objectives for today? So it's been a bit, so I'm going to do a real quick overview of what we covered in part B. Then I'm going to cover reprogramming the inner core, and then movement is medicine. So as a part of this review, I think at this point, I also want to reiterate that when it comes to core conditioning and what we're learning now, there's an outer core, there's an inner core. But when it comes to any part of the core, especially the inner core, it has to be understood that, okay, let's say someone comes to me with no pain, they're in athletics, or they want to improve their aesthetics, and they say, I want to get a better looking core. And they're, expecting all these cool core exercises, which I have. And I'm going to share something with you that authentic core conditioning starts from the inside out, number one, the inner core. But let's go deeper than that. Core conditioning really starts with digestion. So let's look at the middle part of your core. You remember that we have three parts of the core. So we have the upper core, the middle core, like where your abs are and your rib cage or obliques, and then the big psoas that connects your legs, your lower torso to your upper torso. And of course, you have a backside of the core. And they say, well, I want to make this part look better. And I'm going to share with you that in order for that to work better, then we have to look at, again, looking at that middle cylinder. That middle cylinder is between the lower part of the middle of the back. So you have your thoracic spine here. Or let me use the word function. We got to make sure that the subsystem, in this case, what we're going to be talking about here is your viscera and your organ systems in the middle of your core, right around where your abdominals are. And that's right around where the thoracic spine is. So let me explain that a little bit for you, and we're going to look at the thoracic spine and the organs associated with core function. All right, so this image will probably help for us to better see where the thoracic spine is here. So here's your cervical vertebrae, and then here's your thoracic vertebrae. And then we have your lumbar. Now look at these colors. Now what we're talking about here is core function. If you want aesthetic, if you want to get out of pain, then we need a functional core. Doesn't matter how it looks. I've assessed many people who had a fancy looking core, 6-pack of abs, 8-pack of abs, and some of them, their inner core wasn't functioning optimally. Their diaphragm was inverted. They had digestive issues. They had adrenal issues. So never judge a book by its cover. But what I'm talking about here is these digestive disorders create symptoms that may include bloating, diarrhea, gas, stomach pain, constipation, stomach cramps, which can create lower back pain, or can create inner core inhibition. So this inhibition is a reflex, which is known as a viscerosomatic reflex. So when there's any irritation in a visceral organ, it sends signals to the spinal cord, which then creates a reflex response in a related segment of the somatic system, muscle, skin, and joints. Now this is where the response comes in. Related to the transverse abdominis is a reflexive tightening or dysfunction of this muscle, triggered by an internal organ visceral problem. Because the transverse abdominis is involved in core stability and houses the abdominal organs, its dysfunction is often associated with issues in the gastrointestinal or the genitourinary systems, which include the kidneys, the uterus, the bladder, urethral, and the reproductive system. So remember, we don't have a back problem, we have a body problem. And when these stabilizers are shut off, we have to look at the cause as to why they're inhibited. All right, so let me continue. So as indicated in the image on the left, specifically the area of the spine in red, and then blue right above it, and then green right below it. We're talking about the thoracic spine into the lumbar spine. So at these segments, there are nerves that innervate these organs. So hence these lines that are coming from the segment of the spine through the spinal cord. The spinal cord's on the inside, so this is a blown up version of that right here next to it in gray. And it goes to these organs. So let me use this image to better illustrate my point. So let's start at thoracic vertebrae number 4 in green, where it says gallbladder. And then we'll go right down the line. You can see all the visceral organs. We get down towards the bottom of the thoracic vertebrae where it's in green yet. And when we get into the yellow, then we get into the large intestines and then appendix, bladder, and sex organs. So when these organs get over-innervated, they create heat. And to protect the organ, the excess energy or heat goes into the tissues, and one of two things are going to happen. They're either going to get tight or they're going to get weak. Weak would be looking at it from an inhibition standpoint. So you begin to understand that when we look at the phases of exercise at the beginning, depending on the person, we have to increase the parasympathetic response, calm that system down and the organs, and then reboot the system so we can recreate intraspinal stabilization. Remember, there's two main objectives. That you want to get out of pain, number 1, and you want to stabilize your spine, number 2. But you've learned in this series that emotional stress can have an effect on your progress and your maintenance, the biochemical stress and the nutritional stress. So with these 4 stressors in mind, we have to remember that the body is a cybernetic, bioelectric, and magnetic organism in an integrated multi-dimensional system of systems. And these systems are very important because the body systems are interconnected and dependent upon one another to function. And what we were talking about a minute ago was the function of the digestive system in relationship to the inner core. So what we're talking about here is a sub-operating system. So underneath all of these systems is an electrical system. And through this electrical system, there's biosignaling, there's photonic energy, and that's how the body systems are interconnected and dependent upon one another to function. That's how they communicate. It's a very intelligent system. But when there's nerve interference, muscles can either get short and tight or they can get turned off and they get long and weak. And what the first 3 stressors are showing you, that these lifestyle factors, if they're unhealthy, they can get in the way of how our body communicates and how it regulates and how it remains in homeostasis. And when out of balance, eventually we get things like pain. But the takeaway is we have to treat the body as a whole and not the sum of its parts. That's why this is an integrated and holistic approach. So you see what medicine has done is it's carved us out into pieces, looks at parts. And Aristotle once said, the whole is greater than the sum of its parts. That's why a holistic approach works. And you have to look at the body as an integrated multi-dimensional system of systems, and you got to take into consideration organ health when it comes to inner core. You have to take into consideration emotional stress when you got pain. These things need to be looked at, need to be addressed, and that's the nature of this presentation, is to really teach you that we're not looking at you as an individual back problem. You have a body problem. All right, so now let's transition into assessing the core. And I want to cover some myths when it comes to how to properly activate the core. Do we need to always activate it, etc., etc.? But specific to this topic, relieving lower back pain, you're going to need to get that inner core back online. But when we talk about the general population, they don't always need it. So let me go further into that. All right, so I want to cover something here when it comes to activating the inner core. There's been a lot of controversy between ab bracing versus abdominal hollowing. And I don't want to belabor this point for the general population that's watching this video probably could care less. They just want to find out how to activate their core adequately to protect their spine. But just in case you run across the confusing information out there, I just want to say, whatever works for the individual to maintain core stability, I'm open to. But in my personal observations, both in a clinical and private setting, over a 21-year span, because I did learn to do this back around 2004, what I found is that 90% of the people that I assessed, their inner core unfortunately wasn't functioning optimally. Sure, there were a lot of people that didn't really need any inner core work. I mean, I did have clients that had functioning inner cores, so it's not for everybody. But that's my personal observation. And then by using these techniques and the techniques I learned through the Czech Institute in coordination with the chiropractic neurologist or any one of the chiropractors if I was seeing their clients or patients, we found success and long-term success. All right, with all that being said, I want to transition now and I want you to listen to my instructor, Paul Czech, talk a little bit more about inner core function when it comes to ab bracing versus abdominal hollowing or drawing in. Now, this is where I go to school. He's the founder of the Czech Institute. So I want to let him kind of explain the whole abs in, abs out, because that'll tie into my assessment protocol.
Question, abs in versus abs out, based on anatomy, how the body works. So let's have a look at this very important question. Here in my diagram, you can see a picture of someone getting ready to do a squat. So in the first picture here, they've just racked the bar on their back. Now, I teach athletes and individuals to take a deep diaphragmatic breath. And as you take a deep diaphragmatic breath, the diaphragm drops down into the red position, which pushes the belly out. As you know, if you take a deep belly breath, that tightens the diaphragm. When the diaphragm drops down, it has to push the organs down, which causes the belly to expand, as you see here. Yet, with the belly out, as I described in Gem 1 from the Diamond Mind series, the inner unit muscles are not turned on. They're just in a relaxed state. If they were turned on, you wouldn't be able to get your organs to drop down, and the diaphragm would not be able to effectively lace together the rib cage and stabilize the spine. Yet, prior to initiating the movement, which is very, very important, because as you initiate the movement of a squat or a deadlift or bending over to pick anything up, the body bends forward, as you can see here, which increases the lever arm or the load in the low back. So as we initiate the movement, prior to starting the movement, once we've got a nice full breath, which is important because the pressure of the air in the thorax or the lungs creates what's called pneumatic pressure in the lung cavity, which has to create a stiffening system against the abdominal cavity. If a person drew their belly button in or tightened their abdomen and there was no air or tension in the diaphragm, then all the abdominal contents would simply rise up into the chest and you'd be no more stable. So breathing in is critical to stabilize the thoracic cavity against the abdominal cavity. As you initiate the movement, the belly button should be drawn inward so that you create inner stiffness and tension in the inner unit muscles depicted here in red. And that inner unit stiffness stabilizes the entire spinal column and cord to give the arms and legs a working foundation and to create a stable structure.
So the point I wanted to draw was I wanted to have a visual and have Paul explain the whole thing about the stiffening, the inner core, the diaphragm. Now this example of somebody squatting is, a pretty extreme example. But the whole thing is at the beginning when you're working with me and you have pain, I have to reprogram it. We got to reset the timing. And once the timing is set, then I'm going to be teaching you how to activate it while you move your limbs. So eventually I'm going to be having you squat, bend, twist, pull, push. And at first, yeah, you're going to have to initiate some activation. But in the long run, you're not walking around with it turned on all day. You're not having to worry about it. It should work on its own. Like when you sneeze, your inner core activates all by itself. When you cough, your inner core activates all by itself. I want it to be able to work autonomously when you need it. Now, if you're going to lift something extremely heavy, then yeah, you're going to want to stop, get yourself into position, take your breath, and then activate your core. If your goal is to be able to do stuff like that, I will train you and get you ready for that. But for the basic person, in the sessions, yeah, it's repetitive. You have homework that's repetitive, but you're not having to think about it. Once the memory's built in, and you have to pick up your child or go to a exercise class, it's supposed to work on its own all by itself. And then there's the whole weight belt thing. Now, if you have a serious spinal injury, like I had talked to somebody the other day who had a couple of fused vertebrae. This was many years ago, and he's got some screws in his back, and he's on the job wearing a weight belt, and he was asking me, should I keep wearing it? And I said, yeah, you have to. Your inner core function, because of the amount of damage and because of the fusion, you need all the support you can get. But if you're in the gym just wearing it all the time, you're actually dumbing down your inner core because your brain is relying on the belt and you're not using the muscles that are designed to create that tension and that stiffness, in your spine, around your spinal system. So I'm not a big advocate for weight belts. And in my past, when I was lifting with a belt after my injury, I came back 20 years later and was lifting again very heavy with no belt based on these techniques in this system. But my point is this. So just in case, you're confused about ab bracing versus drawing in, I lean more towards what Paul Chek has researched and has demonstrated in years and years and years of practical orthopedic fitness experience and with his knowledge of anatomy. Because what we're talking about here is functional anatomy, tying in with the health of the organism, in this case, the health of your gut. Because you could do all the crunches in the world and you can do all the aesthetic training in the world, and your inner core could still be dysfunctional. Or when my clients come to me with those kind of aesthetic goals and they say, oh, I just can't get anywhere. And I'll say, well, has anybody checked out your digestion? Maybe you got a fungal parasite infection, you got inflammation in your gut, which is leading to inhibition to the abdominal wall and the inner core support. Because once your inner core is strong and you begin to create what they call hypertrophy. I've actually had people say that their waist got smaller because now the muscles are toned up. Again, not because they walked around with it on, right? But any tone you can bring to muscle tissue creates better aesthetics, doesn't it? All right. So I just wanted to clear that up for any confusion out there. We want stability, and the stability that you're going to need is not primarily with the outer core. You don't just need to brace. There's nothing wrong with bracing the core. However, the amount of support is disproportioned to where it's needed at the spinal column. So when you just brace with your outer core, it will provide secondary stability for the spine. But neurologically, because of where the transverse abdominis, the internal oblique, attach, their attachment points to the multifidi, to the spine, that provides segmental stability. So in essence, by activating your inner core, teaching you how to get that thing back online, all based on an event, a traumatic event, a car accident, a fall. We learned about that the body is a multidimensional system of systems, but it's run off of a circuitry system. You have these meridian points that cross arteries and muscles, going back to Chinese medicine, which is up to 5,000 years old. When organs get over innervated, it dumps the excess heat where? Where does it dump it? Into the tissues. You learned about this back here. Association of visceral organ involvement in back pain. So these inner core muscles get inhibited based on these different things. So you now know you have an outer core, which is important to maintain its strength and its reflex activation. Your inner core reflexes on a different neurological loop called the autonomic nervous system. The autonomic nervous system is associated with how your heart beats and how you breathe. So unless you're actually learning how to do diaphragmatic breathing, which you will if you work with me, you have to think about it. So there it's cognitive. But when you go outside of my class, my session, and you're driving your car and carrying on throughout the day, you're not thinking of your breathing. You're only doing it when it's necessary. But when you train it, so when you train something in an environment to learn it, the idea is that then it becomes reflexive in real life. Does that make sense? That's what training is all about. You're relearning so that when you go out into everyday life, this thing should work autonomously, automatically. And it's supposed to reflex prior to sudden movement. So like when you sneeze, those should reflex first. How many of you know somebody, or maybe this has happened to you, that when you sneeze, you lose some urine? So sneezing itself causes a brief but significant surge in intra-abdominal pressure, as Paul Chek was alluding to earlier in this video. And we're going to talk a little bit about this intra-abdominal pressure when we learn to activate the core and breathe at the same time. But through the forceful and rapid contraction of the diaphragm, chest, and various abdominal muscles, including the transverse abdominis, this powerful pressure is necessary to expel irritants, so on and so forth. Now, what happens here is a loss of urine while sneezing is a form of stress caused by this sudden increase in intra-abdominal pressure. And for those people that have an unhealthy inner unit, so pelvic floor, transverse abdominis, and diaphragm, which are all on the same neurological link, and this pressure against the pelvic floor muscles and the urethral sphincter are not strong enough to withstand this pressure, and thence the urine in the bladder gets released. So the point here is intra-abdominal pressure, activation of the core, and showing you that this reflex has to happen not only when you sneeze, but if you're going to move suddenly, jump, throw, catch, and then when you get into athletics, it's a whole nother ball of wax, as Paul was describing with squatting and having that kind of stiffness when we're under a load. That just tells me the pelvic floor isn't on, which means the transverse abdominis isn't on, which means the diaphragm isn't on, which also means that your multifidus probably has sensory motor amnesia as well. Again, these have to be assessed and they have to be reprogrammed. Why? Because the human body is made up of vibrational, electrical, magnetic energy. The human body is a cybernetic, bioelectric, and magnetic organism, an integrated, multi-dimensional system of systems. It is fully capable of receiving, processing, and transmitting information. And by transmitting information, meaning that what we're going to be getting into is there's a part of your brain called your motor control system. And within that motor control system, you have the motor cortex. And that motor cortex sends information down the spinal cord and through its periphery nerves turns on these muscles. Electric. The body is a cybernetic, bioelectric, magnetic organism. So cybernetics is defined as the interdisciplinary study of control and communication in complex systems. Is your body a complex system? Encompassing both natural and artificial systems. So your body is a natural system of systems. Your computer is an artificial system of systems. It explores how systems, whether biological, mechanical, or social, regulate and adapt themselves through feedback loops and information processing. Essentially, it's the science of understanding how things are controlled and how information flows within a system to maintain stability or achieve a goal. Feedback loop, as we're going to be learning about this today. Information traveling from the motor cortex down the spinal cord to these muscles, and back and forth they go. Using this information highway, we learned how to crawl. We learned how to walk, run, throw a ball, tie our shoes. All of this was based off of this control and communication in a complex system of systems. It explored the biological and to regulate and adapt themselves through feedback loops information processing. Bioelectric, relating to electric phenomena in a living organism. Even the heart isn't a pump. It is a portal for living plasma. Your lungs are the pump, and your heart is just a valve, a vortice, to allow blood flow in and out through electrical propulsion. So why do you think we need a defibrillator to shock your heart? That's called electrical cardioversion. And that low energy electrical shock is there to reset the heart's rhythm. You can either go to my business Facebook page or my Rumble channel. I go into this topic really deep when it comes to the cybernetic, bioelectric, and magnetic aspects of the human organism. But for the sake of this presentation, I'm trying to draw a parallel between bioelectricity and biosignaling and the information that needs, or how information gets to your inner core. Magnetism is the force of nature produced by moving electrical charges. You're moving electrical charges right now. Your body is filled with voltage. It's a capacitor. It has capacitors, resistors, and transistors. Your body is piezoelectric. So the human body is a circuit of resistors and capacitors. It has a direct current. So at the top of the body, it's positive. At the bottom of the body, it's negative. Negative charge with the negative earth. Positive charge with the sun. All voltage in the body. So you have this voltage. And if the voltage is dysregulated, you get sensory motor amnesia in this case. The human body is like a battery. And the body, human body has 4 battery packs, the largest being the muscles, and muscles are piezoelectric. In order for you to ambulate across the earth using a negative charge from the earth, that pressure, when muscles contract and relax, they emit electrons. That's what moves your blood through your heart, through your bloodstream as much as movement does. But movement is piezoelectric. So it comes down to the underlying operating system of the body is bioelectricity. Through piezoelectricity, we emit electrons. So if you want to learn, again, if you want to learn more about this, you can go to my Rumble channel and follow me there. I have a plethora of education to empower you with knowledge. Me on Facebook. And here again, all of those videos that I put up on Rumble are here as well. And then we talked about integrated, we talked about systems of systems. Your body is like a computer. I'm on Zoom, and I'm in Word, and I'm in my PowerPoint all at the same time. I can open up any one of these systems and they'll integrate together. So how can we not understand that when it comes to something like the inner core and bioelectricity and this whole sensory motor amnesia thing, how do we not know? How can we not understand that the body's electric? We're just rebooting it. You got blockage. Like nerve interference is like when you go to the chiropractor. How many of you go to the chiropractor and you get an adjustment? Well, through pressure changes, he's removing interference at that particular area where he is adjusting. You go to an acupuncturist and he or she uses acupuncture needles at specific meridian points to relieve blockage, pressure. Energy has to flow. If your inner core isn't working and you're in pain, number one, the pain is shutting it down. There's a block. Number two, once we remove the pain, we got to reboot the system. And I can't do that without a chiropractor. I can't do that without a soft tissue person. It takes teamwork to help your dream work. What is your dream? What would you like to do if you weren't in pain? Remember? So that brings us to our topic. Reprogram the inner core muscles. The core works via the sensory motor control centers of the brain, specifically within the motor cortex. Ascending, going up. Proprioception involves sensory information such as position of your limbs. So when you're walking, you're snapping your fingers. There's information that's traveling to your brain all the time, traveling from the body up the spinal cord to the brain, and descending proprioception is not a direct pathway, but rather refers to an influence of motor commands from the brain that modulate proprioceptive feedback. What I'm doing when I'm going to go through these exercises is I'm rebooting the system. So think of your motor control center. You can think of your whole brain like the central processing unit in your computer. So I'm reprogramming. So sometimes there's an error. I've often had errors technically in my computer, and sometimes it's an operational error, and sometimes it's a computer error or a systems error. So then I got to call the manufacturer. Brain, motor response, sensory system, cells that fire together, wire together. You have nerve cells, you have muscle cells, and we have these two dendrites. And in between here, you could see the cellular communication, what they call biosignaling or cellular communication. And it is the ability of living cells to produce, receive, and respond to signals from their environment. It is an essential function that regulates cellular activity and coordinates biological processes. And what we're talking about here is this signaling has to happen in order to create this activation process to these inner core muscles. From the minute you came into this world, you started to write and create neuroplasticity so that you can learn yes from no, hot from cold. And in our case, what we're going to be doing is turning on inner core muscles, learning how to focus on your diaphragm and get those cells to fire and activate. That's activation. And then wire is making the connection. And after you repeat the process so many times, what happens? You develop a memory. In this case, they call it a motor engram, or you can call it a memory. And they do this a lot with people that have had strokes or any kind of cognitive challenge. They can through neuroplasticity, you can rewire the brain. You can learn new behavior. So why can't we reactivate the inner core? And again, you may be learning some of the details behind it, but all you're doing is you're doing the exercises. You leave all the details to me. All you do is follow the system. You're just getting the details to how the system works. How does your core work? Where is your core? See, that's the difference between this presentation and a basic presentation about low back pain. Yeah, I'm getting a little technical here and there, but I think you're getting the idea. And I think the takeaway is now you know what's missing. If you're in that asymptomatic group, or we go back to, let's go back up here for a second, just as a reminder. Remember this, approximately 90% of lower back pain cases are considered non-specific or idiopathic, meaning the cause of the pain cannot be confidently attributed to a specific underlying spinal condition or tissue damage. So there you are, scratching your head. You've been to practitioner after practitioner after practitioner. And my hope, by the time we get done here and you're learning from this presentational series, is that you are now going to have a better understanding and better discernment to ask a better set of questions, or to seek out a practitioner that takes an integrated and holistic approach and gets to the cause of your lower back pain. Or like that young man that I work with here in Jacksonville. Remember, the shoulder pain, the back pain, the knee pain, the heel pain, physical therapy, a number of trainers. Nobody could figure him out. So what I did is I took a deep dive and looked at his lifestyle factors, and lo and behold, that's exactly where we got started. So the key here is lifestyle factors. Changing the lifestyle, the other stressors, he's no longer scratching his head, and he's empowered with knowledge. He is now managing his lifestyles far better than he ever has. Cells that fire together wire together. So we have to get this inner core back on, and there is a process to this. You know, especially because in this case, we're using the word pain in the description. We got to keep everything low and slow. All right, so we're going to get into this reprogramming here. Exercise does more than boost your body. It's remodeling you. It's reprogramming you, if it's done right. And we're going to be getting into movement is medicine. And with all those people that came to me and were up and went to all these other places, well, do you think they had the wrong prescription? If my clients went to the right practitioners, why would they have to go back and forth, back and forth, back and forth with the on and off pain? Because we're not treating the body holistically. We're not getting to the cause. But there's a process to this. And in the process, there are some things that are taken care of. But then there's some things that are missed, and that's my job. That's what sets me apart. It isn't that I'm better. I'm not better than anybody else per se. I may have more knowledge in one area, but another person may have more knowledge in another. It's the standards that I hold for myself and how I service my clients that makes the difference. So we have to reprogram. And there are 3 stages to motor programming. All right, so let's look at the 3 stages to motor programming so that we can write a new motor program. So what are the stages? The first stage is cognitive, which means you need a lot of attention, a lot of concentration. Remember when you first started learning to maybe ride a bike or drive a car and tie your shoe? You needed for it to be quiet. You had to concentrate. You had to focus. When you get to stage 2, more of associative stage, now you have a moderate level of attention. Now you can kind of do a couple things at one time. So you can do a little bit more. You have a little bit more cognitive freedom, and you can increase the level of difficulty of whatever you're doing. And by the time you get to stage 3, now you're in real life. You can be running, you can be lifting weights, you can be playing your sport. You're out there moving your wheelbarrow, not thinking about where your core is and all this other stuff. You're driving your car, you're listening to the radio, you're able to ride your bike without training wheels, you can tie your shoe while looking at your friend at the same time. It's now autonomous. At that stage, you've written a new program, new motor program. The human body is bioelectric. It uses a combination of electrical, biological, and chemical signals to communicate and coordinate its functions. When there is stress imposed against bones, ligaments, tendons, cartilage, skin, teeth, collagen, and fascia, it emits electrons. This process is referred to as piezoelectricity. And yes, the body's magnetic. The human body generates its own electromagnetic field due to the electrical activity generated when the body is in motion, thus producing a magnetic charge, and with that charge comes a field of magnetism. The heart itself is the body's largest rhythmic electromagnetic field, and there are more neurons in the heart than there is in the human brain. Now, with all that being said, this is how that system gets reprogrammed. These are the things that are involved. And again, the purpose of me going into a little bit of detail is to bring some awareness to the fact that the body is a cybernetic, bioelectric, and magnetic organism and an integrated multidimensional system of systems. So now let's take that information and put it to work. So now we're going to enter into the movement as medicine part of this discussion, and I'm going to start talking about corrective therapeutic exercise. Now we're going to be talking about activating the inner core, but then we're going to talk about corrective therapeutic exercise, but in a thumbnail sketch. I'm not going to go into a lot of details. There's a lot to cover when it comes to what I really do, or what someone should really do when it comes to getting you back to your dream. Remember the stages and phases that are sometimes missed because you're released too early? Just because you're out of pain doesn't mean you've cleared everything. That's a great hurdle. I've often told the patients, they'll say, well, I don't need to continue with my corrective exercises because I'm out of pain now, or I don't need to go back to the chiropractor anymore because I'm out of pain. No, you don't need to go back to the chiropractor 2 days a week. You may want to go down to 1 day a week or 1 day once every other week. And you definitely don't want to quit doing your corrective exercises because we just got the thing started. So you need to finish, you need to finish the system and at least get through a number of phases until we reach the desired result based on your dream. So if you just want to get back to yard work and daily activity, then you don't have to really go as far as somebody who wants to get back to tennis or golf. And I'm talking recreationally. And you have to spend more time if you want to get all the way up to playing sports at a competitive level and really get to high intensity training. All right. So I just want to make that clear. But to make it easy, again, if you're taking prescription medication, why do you have to get your prescription refilled? What's the exit strategy? So yes, exercise is like medicine. in so many ways, exercise is prescribed in a specific dosage and formulation to each person. Now, this is the other thing. No two low back or back injuries are the same. The prescription must be very specific regarding exercise modality, intensity, frequency, and duration. Clearly, it is not enough to have trainers and healthcare providers tell their clients and patients to start an exercise program without having them getting physically assessed first. And specifically, what we talked about earlier is how many people are having their inner core assessed, their diaphragm assessed, their lifestyle assessed. It would be equivalent to telling a patient to just take some pills, and no provider would do that. Here, just take these for your pain. What if you're on a different medication and you can't mix those two together? So don't guess, get assessed. Now, flexibility is at the bottom. We want to restore flexibility. Now, and again, we're talking about core conditioning here, but I don't want to leave out the fact that yes, I address flexibility and mobility. Remember, I was saying sometimes I refer out to a body worker, a myofascial therapist, a neuromuscular therapist. And if I'm referring them out, like that gentleman I'm working with here in Jacksonville, I referred him out to a body worker, and a body worker and I communicate. I asked him to check a few things for me. And I also asked for his feedback. Let me know if you find something that I need attention to. Active stretching versus static stretching. Now, if you go to my blog page on my website, so if you go to About, go to blog, I think this is on page 6 or 7 here. I wrote an article about mobility versus flexibility because I get a lot of questions regarding should I statically stretch or should we use an active form of stretching? So I went and I wrote an article on this. And basically what I talk about here is that first I want to define the difference between mobility and flexibility. So mobility is the ability of a joint to move actively to a range of motion. Muscle tension, tissue quality, and how the nervous system controls the joint all come into play. Mobility requires maximally efficient motion performed on demand in any direction at any speed, characterized by smooth transitions between movements. Whereas flexibility is the ability of a muscle or muscle groups to lengthen passively through a range of motion. The ability of a muscle or extremity to relax and yield to stretch and stress forces. Numerous scientific studies have failed to prove that stretching is able to be maintained long term. The effect is only temporary. And if you are trying to stretch a muscle over a joint that has a mobility restriction, you're going to get nowhere fast. According to this research, runners run more slowly, jumpers jump less high, and weightlifters lift more weakly by stretching without significantly insuring against injury during their exercise. So in contrast, movement and mobility prep, or warming up, we call it movement and mobility prep, have the opposite effect, boosting blood flow, activating the central nervous system. Here we are again. See, we have to wake that system up. And I'll tell you why in a second. And enhancing strength, power, and range of motion, because you're going to need strength and power to get in and out of a car. This is all depending on the person. So just follow me here. Getting in and out of a car, lifting a child, bag of groceries, going up a flight of stairs, and then we can go up the ladder, right? We can move suddenly, right? Remember, it depends on your dream. As a result, they offer a host of both immediate and long-term benefits. It is based on movement and motor control. Your central nervous system will limit your mobility based on how much control you have as a way to keep your body safe. So here again, a good level of mobility allows a person to perform movements without restrictions, while a person with good flexibility may not have the strength, coordination, and balance to execute the same movement. Good flexibility does not always denote good mobility. So the key words are active and passive, just like therapy. So when you lie on a table and a physical therapist does body work on you, or you go to a massage therapist or a neuromuscular therapist, you're just lying there passively and they're doing the work. So even if they were stretching you, which I've done, stretching for my clients, there's a time and place, don't get me wrong. But again, what gets left on the table is the minute you stand up and now you're against gravity, you get off that table and you have to ambulate through through time and space. If that system has not been reset, the subsystem still has to be reset. It still has to be, because when you are actively using these muscles, so look at these two pictures here. Here I'm sitting on the floor doing a piriformis stretch. So I'm just bending forward, stretching my piriformis, holding that for 10, 15 seconds. This is at the end of my training routine. That's when I'll do my static stretches. Now, therapeutically, again, I want to add that sometimes I do static stretching in therapy in phase one. There's a time and place, but soon thereafter, I'm going to switch that into active. So here on the floor, I'm doing an unloaded version, and you see the picture below, figure two. I'm doing a loaded version of the same stretch. So down here, in order to bring my leg up across my body, I'm activating certain muscles so that I can adequately increase the range of motion in the joint. In this case, we're talking about my right hip. But meanwhile, while I'm doing that, I'm not just swinging my leg up randomly, because I could be overstretching the ligaments in my back. I could be ineffectively stretching my hip because I'm rotating my hip too far towards the left, etc., etc. Now, loaded, there's a lot more going on, isn't there? Now I got to balance on one leg, so now I'm using my cerebellum, I'm using my balance. My core is going to definitely work more. And I'm talking about your outer core now. But before I swing my leg either in an unloaded position or a loaded position, I'm not having to think. Now on the floor here, I'm still teaching my client to activate their core. See the towel roll. We'll get to all this. Activate your core first. Provide stability so that we can adequately increase mobility, because stability and mobility happen simultaneously. Again, going to the standing. So I step forward, swing my right leg up and across with it bent. I activate my inner core. By now, I don't have to think about it. Now I should be in stage 3 motor learning. And now I just pick up that leg, move it across, and I got stability and mobility happening simultaneously. Let's see if we can find a picture of that. So active isolated stretch. We'll go to an advanced version. This would be loaded. So here's a tutorial video I did specifically for this client. Now this is the same exact stretch you were doing lying down. So the same foot position, leg position. And like I explained in the active isolated stretch for the thigh, watch so that your lower back doesn't come out of neutral. So in other words, we don't want excessive movement to the core, the lower back area, the middle of the core, I should say, as I bring the leg up. And here I'm explaining that in order to elevate my leg and bring it up diagonally, I have to use my hip flexor and my adductor. That's the active part of the stretch. By turning on the hip flexor and the adductor, that will reciprocate and turn off the piriformis, allowing it to stretch. Then I'm also rotating my hip in the opposite direction of which I'm pulling the leg. Let's listen in as I teach this to my clients. So I come across 1, 2, 3, 1, 2, 3. And what I'm thinking about, good upright posture, this is gently activated. As I'm bringing the leg across, I'm using my hip flexor and my adductor to get my leg up there. And then as I'm holding it, forcing that hip in the opposite direction as I'm pulling the knee across. But each time, you're upright. Good posture, hold that, walk yourself down. So that shows you a lot of motor control here, and that's standing. Now lying, again, as long as we're moving forward, we're looking at mobility here. Please note that some of you that are watching this video may still be using the towel. Now, I haven't gotten to the whole towel roll thing yet. Kind of jumping ahead here, but we want to talk about flexibility and mobility first. So this is unloaded. So isolation, I'm sorry, I'm not using my nervous system as much. I don't have to worry about balancing or moving the body. Your lower back directly opposite of your belly button. Those of you that have graduated from that point, now in order to get your leg up there, you're going to have to use your inner thigh muscles. That's your adductor I'm pointing to, and your upper thigh and your hip flexors. By using those two muscles. Now, normally my head would be back, but for the sake of the tutorial part of this video, I have my head elevated off the floor. That will help to turn off the piriformis, allowing it to stretch. That's called reciprocal inhibition. You want to line the knee up with the center of your body, so your sternum or your chest bone. Place one hand across your knee and the other hand on your shin, and as you gently pull the leg across towards the opposite shoulder, couple of things. You want to prevent your hip. In this case, I'm stretching my right piriformis. I want to prevent my... So now I'm stretching that piriformis, and because I elevated my leg manually, actively rather, I use those particular muscles, which then turn this muscle off and allow it to stretch. Hip from rotating up. Here, my foot is in dorsiflexion. What I just mentioned is as you're pulling your leg across to the opposite shoulder, if you will, you don't want that hip to come off the ground, because then we're taking away the effectiveness of the stretch, and then we're going to be like stretching out our ligaments in our back. And again, we're looking at economy and motion. We want to get the most out of this active stretch. All right. So active stretching or prep is done prior to activity. Static stretching is always done at the end of the day or at the end of your activity. But once again, I want to stress, if I may use the term, I want to stress that there's nothing wrong with static stretching in therapy. There's a time and place. Proprioceptive neuromuscular facilitation, refacilitation, that would be PNF stretching. That's very effective. And again, if you're being stretched by somebody else on a table, there's a time and place for that. But remember, in order to reprogram that nervous system and get it ready for vertical activity and making sure that things are working in that loaded posture, you have to coordinate passive therapy with active therapy. And the way I do it, I did it with my clients, or I do it with my clients, is I actually reprogram the nervous system. Stability, motor control, neuromuscular isolation, and integrated exercises for optimal joint control. Then we got to get to strength. Does everybody need strength? Yes. So why do people need strengthening? Connective tissue strength for from unloaded to loaded postures. We're not talking about weightlifting per se yet. We're in a, but you still need strength. You need strength endurance for the inner core. You may need strength endurance for the outer core. You may need strength endurance for connective tissue. You're all going to need it. And then when you go way up the ladder, then we're talking about other types of strength conditioning. And then power, enhancing the client's ability to generate and absorb the forces which helps prevent injuries from unforeseen circumstances. So when you get into my phase 2 exercise system, you have to get some sort of power training in. So as an example, so let's say your child runs up and wants to be picked up suddenly. Ever have one of your kids run at you and all of a sudden you're picking them up? Well, that's an essence of power activation. You have to have the strength, the reflex, and the power to pick that child up suddenly or to catch them suddenly, right? Your child's running towards the edge of your property, going towards the street, and you're running across the lawn like a sprinter. That's power. You want to catch that child before they run into the street. Another example, you get in a car accident. Boom. See, reflexes, that power, that force. Are your connective tissues and are your muscles reflexing to protect you? And I always tell people this, they're like, oh, I'm in better shape now. I'm not going to get injured. And I go, no, no, no. Especially my athletes. No, no, I've reduced your chances, but I'm not saying you're not going to get injured. But I will tell you this, you're going to be in a lot better shape and you're going to recover quicker. So my recovery was real quick after my surgery on my wrist. All right. So phase and progressions of exercises. Now, this is what I was talking about. So what gets left on the table? Again, what is your dream? Right? What would you like to do if you weren't in pain? What would you like to do if you weren't in pain? So phase 1A and B is sub-base conditioning. Sub-base, remember, where's your sub-base? Inner core. So we need to go deep. That also means, doing the work on your nutrition and all that too. But sub-base conditioning, restoration and reprogramming. In phase 1A, we are at stage 1 motor learning. Because of the sensory motor amnesia you have to the inner unit, you need to have full attention so that you can reprogram these neural reflexes. Remember, stage 1 motor learning, high cognitive activity, a lot of thinking, a lot of attention, a lot of concentration. All the exercises are done, what we used to say, low and slow. So low meaning we're low to the ground, which is unloaded, as I just was showing you in the video with flexibility and mobility. You have loaded and unloaded, active isolated stretching. Because depending on your spinal condition, we can't put you in a vertical position yet because our infrastructure, the subbase, the inner unit, won't be able to do its job effectively to stabilize your spine because of the sensory motor amnesia. So then we isolate the exercises for a short period of time until we can build the memory, build some repetition. And what I mean by slow, low and slow, the repetitions are high because those muscle fibers require lots of reps. They like a lot of oxygen, but they're done mainly at a slower tempo. All right. And as we migrate into B, then I start to slowly integrate. This is all neuromuscular reprogramming, by the way. So I start to integrate, and I'll show you examples of all this. And along the way, you're graduating through phase 1A and 1B. I'm reassessing you just about every week, every other week. I'm checking your homework. And as you progress, and then we reassess you, then we transition you into phase 2A and B. Now you can get to the base conditioning. Now in this transition, this is where sometimes traditional physical therapy fails. They don't quite transition you far enough so that you can get back to full-fledged daily activity, fitness, recreation, sports. I'm not saying with all of them. So as an example, my client has on and off pain for 3 years, 5 years, 10 years. On and off, meaning they get better, but then they go back into pain. And when I asked them, did you go to physical therapy? Did you try training? What did you do? And most of the time, they did a pretty good job at the beginning, but the transition wasn't there. Because the minute that client starts to feel better, or the minute your sessions run out, depending on your insurance, and you've met their standards are different than mine, then you get released. And then, a lot of times the physical therapist will suggest that you continue doing your homework. And a good physical therapist will also kind of warn you, saying you're not quite out of the woods yet, continue doing these therapies, and you may want to continue working with a trainer that has some post-rehabilitation exercise knowledge. And meanwhile, while the patient is exiting physical therapy, most of the time, the emotional, biochemical, and nutritional stress factors have not been addressed. But I wanted to make that point because when my clients came to me, that transition was never filled. So they went back to their activity, hence my client here in Jacksonville, he went back to the weight room and he was all stoved up again. He was all back in pain. So we need to get you into base conditioning, but you need to earn your rite of passage by first clearing the neurodevelopmental phase, which is phase 1A and 1B. And let me mention here about resistance. The only resistance you're going to use for phase 1A is your body weight. And of course, we're going to keep you unloaded so that we can focus on mainly isolated exercises to enhance your sub-stabilization system that will enhance both your strength and endurance for those deep stabilizer muscles. And then when I transition you to phase 1B, I may use some tubing, some bands, maybe some light weights. And during 1B, that's when I start introducing a little bit of axial loading. So as an example, I may have them kneeling on the floor and doing bending exercises or pulling and pushing exercises from that position, or asymmetrical half kneeling position where there's a decreased base of support. So with each exercise session, the exercises are progressively becoming a little bit more difficult, but by the time you get to base conditioning, you should be able to use everything you learned in the sub-base conditioning phase, 1A and 1B, and it should carry over into the base conditioning phase, 2A and 2B. At this point, you're well into stage 2 motor learning, the associative stage. And in phase 2A, this is where I introduce you to the 7 basic movement patterns. Now these would include your squat, lunge, push, pull, bend, twist, and gait. This is because we need to have these 7 basic movement patterns restored and optimal just for everyday life. Later in this video, I will be elaborating more on this topic. So now we really get into the topic, movement as medicine. How we prescribe exercises for this topic is very, very important. Even if I were prescribing exercises for someone who doesn't have pain, but let's say they still have poor sleep-wake cycles. So if somebody has an unhealthy circadian rhythm, their nutrition isn't the greatest, stress issues, right? Because we know that'll play a role with that, and then will affect their spinal stabilizers. And then lastly, there are the 3 muscle imbalance syndromes. Movement as medicine has everything to do with what we're talking about here. Because we're at number 4 here. And now you're ready to, what you've learned thus far is we should be taking a team approach. When in doubt, refer out so that we can get some of these issues handled. And a lot of these issues are not too tough for people. Learning how to breathe is not only going to help your posture, but also going to put you in more of a parasympathetic state. Remember the difference between sympathetic and parasympathetic? Parasympathetic is rest, digest, all right, calming. And then sympathetic is fight, flight, or freeze, which is action, getting your sleep where you need to be. Again, we need to get you into a healthy circadian rhythm so you can repair and restore the damage. You got to put the right fuel in your body. And if you do have some of these issues, they will need to be addressed. Again, this is all about the cause. Integrated holistic approach to relieving lower back pain is looking at getting to the cause of the issue. All right, so now we migrate down because those other things are in play now. So if I'm not addressing the emotional, the biochemical, the nutrition, then it's a bad prescription. No matter what I give you for exercise, there's still stuff missing. And again, when my clients came to me, there were a lot of missing pieces. You don't go out and just randomly take drugs either. I mean, if you're going to a doctor and you have a prescription, that we have to make sure there's no contraindications between other medications. That's what your doctor will do, rather, because he doesn't want you to have a side effect. If you're taking one med and it's not working with another, you might have a change of blood pressure. You might have fluid buildup, and that's a side effect. You may have constipation. Well, with exercise, it's no different. And at the beginning, in phase 1, all the exercises are done low and slow. Remember what I was saying? We have to reset the nervous system. Reset. Never have to turn your computer off and turn it back on and everything kind of reset for you. We have to reset the system. And at the beginning, we can't overstimulate a system that's already overstimulated. So what I learned at the Czech Institute was a term called working in. And Paul helped us to understand that there's a big difference between working in versus working out. So let me elaborate on that a little bit because it'll be vitally important. So before we earn our rite of passage to the box below here I'm lifting all this weight. Notice there's no weight belt on. Remember, I had a bulging disc. I had an inguinal hernia. I had the digestive issues. And I came back 25 years later and they said I would never do this. But I started up here in this box. I had to reset my system from the inside out. I had to address these lifestyle issues again, make more changes, and reset my system using the principles of working in and mindful movement exercises. And then using it on me and then my patients. And later when I opened my own facility, I did the same thing with my clientele. Why? Because the difference is at the beginning of restoration, it's all about resetting, reprogramming, right? A system that's over-innervated. We need to calm it down so that we can properly restore the programs. But if you keep plugging things into a light socket that can't take the demand, you're going to just keep tripping your breaker box. You will create more and more interference. And that's like a side effect, like when I mentioned side effects to drugs. Several years ago, I wrote a couple of articles called The Yin and Yang of Exercise, a part one and part two. Now, I'm going to refer to some of the information in part one to help you understand more about the importance and what it means to work in and to use a mindful approach to exercise. So let's start by first understanding the principles of the yin and yang symbol. Now, the first thing is we usually see the yin and yang symbol depicted in black and white. And what I did when I rebranded my business back in 2016, when I hired my graphic designer to come up with a new logo and colors, he picked green because it represents growth, and he picked orange because it represented action. So the green represents the yin, and the orange represents the yang. So, and in the yin, there's a little bit of yang, and in the yang, there should be a little bit of yin because we have a little bit of both in us. It's just when the pendulum swings too far, so hence when somebody's in pain, they have too much yang, so they need more yin. But we don't want to take all the yin out, nor do we want to take all the yang out. So yin is the negative, passive, or feminine principle. Now, I'm not saying negative from a disempowering standpoint. That's to take away. We need to take the pressure off the system. It symbolizes inward anabolic energy. That's to build up. So now I'm going to refer back to the circadian rhythm when it comes to yin and yang. So this is too much yang, and here's a balance of yin and yang in your circadian rhythm. It represents night, cooling, unity, nature, create, mindfulness, desire, building or joining together. So think of a woman that's having a child. That child is growing in her womb. It's going through the yin process. Essential activities for repair, regeneration, and quietness. Where yang is the positive. So that's the charge. The positive charge versus the negative charge, or masculine principle in nature. It symbolizes outward catabolic energy and represents breaking down or division, heat provoking, and inflammation. So going back to the bottom box here, that's working out, to exercise, to express, to perspire. I'm getting that out of me. It also represents inflammation, fire, heat, as opposed to yin, which is more water and cooling. And then you have the empowerment of willpower, transformation, and the expending of energy. So yin is associated to the parasympathetic system, where yang is associated with the sympathetic nervous system. And we need a balance of both. And exercises at the beginning of any kind of restoration program need to be more yin than they do yang. Remember how I was saying that at the beginning we want to have the exercises in an unloaded posture? Because when you get loaded, when you get vertical, there's more neurological stimulation, so that becomes a more yang, a more workout. Balancing on one leg takes more effort, where lying on your back doing an exercise takes less effort. So, so we have to be very careful on how we prescribe exercises. And then what I'll do now is I'll start going and showing you examples of working in or mindful exercises. And then, of course, we all kind of know what working out is. And as you transition through the phases, you come out of that phase. But let's say you're, like my clients, they graduate, they're in base conditioning, or they're in phase 3, and, they had a rough weekend, they went out, they had a good time, or maybe they have some stress related to finances or relationships. Well, then what I do is I suggest that they do some mindful movement exercises to restore the system. Or they're not feeling well. Maybe they're going through a detoxification period. Well, that's when they should be doing their mindful movements. Tai Chi is mindful. Soft yoga could be mindful. Qigong is mindful. Going for a nice walk in nature with your feet in the grass is definitely mindful. So that's when we can medicate the body, naturally, of course. That's when we can use exercise as medicine. We use movement as medicine. But if my client comes to me and says, I had a hell of a day, I want to work out today, well, I'm going to assess him first. And then I have to decide maybe I can still work him out, but I'll probably only work him out at 70% of his effort. Or like I've done a lot of times when clients have come into my facility and they had a rough couple of days, I simply adapt and I implement a work-in and mindful movement exercise strategy. Now at the beginning across the board, everybody's going to learn how to breathe diaphragmatically. But the bulk of the work-in and mindful movement exercises are carefully selected based on the client's their rating, if you will, emotional stress, biochemical stress, nutritional stress, their physical assessment, maybe their spinal condition. And these exercises are based off of various styles: Feldenkrais, yoga, Tai Chi, Qigong, and the principles of Chinese Makaho stretching. And all of them, they have one purpose in mind, and that is to move stuck energy, to remove the interference. The exercise implement certain breathing techniques, and or the movements themselves are done at a breathing pace so that I never overexcite your nervous system, you're never out of breath, and we don't raise your body temperature. They help both the meridians, Chinese acupuncture. So you have a stomach meridian, you have a bladder meridian, you have a large intestine meridian. They also help the chakras. So you see behind me here, you have the chakras. You have your root chakra, your sacral chakra, your solar plexus chakra, your heart chakra, throat, and your third eye, and then your crown chakra. If you're into those, that's cool. If you're not, don't worry. It's not voodoo. This is science. These chakras are part of your anatomy, whether we have been taught that or not. They cross arteries and veins cross these crucial points, and if they get blocked, we have problems. Trust me. I got the science to prove that. Go to my Rumble channel, and you can learn all about that in my my episode, my series called The Next Evolution in the Wellness and Movement Industry. I cover that in I start covering that maybe in episode 5. I'm up to episode 9 right now. So when you see these exercises, they have a number of different purposes. And again, in the tutorial video, I give a lot of detailed instructions because my clients, they go home and they do their homework. So here's my teaching philosophy. Give a man a fish and he will eat for a day. Teach a man to fish and he will eat for a lifetime. And basically the quote distinguishes between providing immediate relief, a single fish, and fostering lasting capabilities and learning how to fish. So let's start with the two-dimensional breathing. So we have 3 dimensions that we learn in breathing. And I start everybody out with the first dimension. So I'm going to teach you the first dimension. I want you to do this lying down if you're watching this. You try it seated because if you get it, you get it. Who knows? You might get it. But lying on your back with your knees bent, make sure you're comfortable, relax your neck and your shoulders. Put one hand on your chest, one hand on your belly. You're going to breathe in and out through your nose. If you can't exhale through your nose, exhale through your mouth, but don't just blot the air out. Let it out slowly. You're going to breathe in for about 3 seconds and exhale for about 3 seconds. And when you breathe in, the first dimension out of 3 is breathing straight down here first, letting your belly expand, and then 1/3 is up into your chest. So you're going to inhale through your nose, exhale through your mouth or your nose slowly. Again, you should feel your bottom hand move first. You should see the air travel down into your diaphragm. Your diaphragm contracts as it lowers. Your diaphragm is also a spinal stabilizer. Remember, we learned about that. You want to control the breath, control the contraction to build strength in that muscle. But here I'm explaining the second dimension is you're not only breathing down, but you're breathing out into your ribs. Got to loosen these ribs up. Everybody's been splinted because I got a back problem. They're all tight. Oh, my back hurts. Everything gets tight. The third dimension is letting your floating ribs expand. So first dimension, second dimension, third dimension. In this video, you're doing two-dimensional diaphragmatic breathing. So the first dimension of breathing was breathing down into the belly, 2/3, 1/3 into your chest. Now for the second dimension, we go one step further. We still breathe down into the belly first, but now we're allowing and feeling for the ribs to expand outwards. Your hands are there as biofeedback. You're doing the slow nasal breathing, and the pace and the tempo of the breathing will be indicated on your corrective therapeutic exercise system, as everyone has a little different tempo. Main thing here is to relax, focus on the breath, moving it down into the belly, out into the hands. 1/3 is still up into the chest in the upper rib area. Try to relax your neck, your shoulders, and remember to be. So as I inhale, you'll see that my hands sort of separate here. Present and be right in the moment as you practice this exercise. So here you're in stage 1 cognitive learning. My eyes are closed because my hands are providing me with biofeedback. There's that cybernetic part of your system. There's that feedback loop. And I'm in touch with my body, which is another thing. You heard of the mind-body connection? How about the mind-body disconnection? That's very important, ladies and gentlemen. I can't stress that enough. So many people are disconnected from their anatomy. And when they work with me, they're learning to get back in tune with their body. I want them to feel that. I want them to be a part of that which is greater than themselves. So breathing from a survival standpoint, that's to me number one on the survival list. Because how long can you go without air before you die? Maybe 3 to 5 minutes shorter if you're a child. How long can you go without water or food? You got to eat, you got to drink. And then after that point, then you got to have, right, you got to have a place to sleep and the other parts of that survival process. But number one is breath. And in rehabilitation, the diaphragm is a stabilizer. It talks to the inner core. If that diaphragm is not on adequately, then we're not adequately retraining the inner core. Again, doing what's right, or if I might say, I don't do anything half-assed. Why? You're paying for it. If you're going to have your car repaired, you want it done half-assed, or you want to be able to get the most out of your investment? I rest my case. So many people have come back to me and say, well, nobody ever looked at my breathing, and nobody ever looked at my sleep. And I'm not sitting there telling them that they had a half-assed job from these people, but I'm thinking to myself, my goodness, how much money, I would ask them, how much money did you invest in your lower backs before you got to me? And you know, if you watch part 1, the dollar amount was anywhere from $5,000 to $21,000. I'm not shitting you. And in my coursework where I study, my instructors, their clients had invested more than that. Just not right. So that's working in. And the breath is important. because the breath is regulating the nervous system. It's calming down the amygdala center in the brain where you process emotion. Remember, your brain's a processor. You feel emotions in your heart. You bury them in your gut, but you feel them here. You only process them up here. You're calming that system down, parasympathetic, calming down the sympathetic system. You know, when you inhale and exhale through your nose, or even if you just inhale through your nose, you have little hairs in your nose. And as the air runs past the hair follicles, it stimulates the parasympathetic system. There you go. Did you learn something new today? All right. Now, another pretty popular one for certain clients, not for everybody, you're going to be opening up the meridian for the kidney bladder, which runs behind the legs, inside the legs, up the abdominal wall. And then you have bladder and kidney points at certain parts of your body. Again, they cross arteries and veins, and you're opening those up. And if you remember watching the other parts, I had a client, I was suspecting, I did some kinesiology tests, and the kidneys kept showing up in the bladder. And I asked them when they were going to be going to see their acupuncturist, and they said, well, I'm going to see him next week. I said, would you just have them check your meridians and let me know what they find? And they found the bladder kidney meridian. So they opened those up. Thank you for that. The kidney bladder are associated with your adrenals, and your adrenals are associated with cortisol and other hormones associated to sympathetic drive. So this will calm those down. We'll get the meridians open. Remember, we talked about blocked energy. So if I have a hose, a water hose, and I bend it, I'm stopping the flow of water. You don't want your, stagnant water decays. That's why you got to move the body. This is taken from the Chinese Makaho series of exercises. Let's start with the meridian points that we'll be tapping and tracing for this stretch. First is the bladder meridian points that are located here by the inner part of the eyebrows. You will tap them for the length of one slow nasal three-dimensional breath before you go down to the kidney points. So the acupuncture meridian points for the kidneys are located where the green dots are, just to each side of your clavicle. And again, you'll tap these points. And then we're going to follow the kidney meridian down, the meridian pathway that goes right down over the chest, the abdomen, the inner part of the groin, the inner part of the thigh, side of the calf. And you're going to make a circle around the ankle bone before getting to the bottom of the feet, where there's a reflex point for the kidneys, as located with the little yellow kidney at the bottom of the foot. That's where your fingers will be placed. You'll place your middle or first finger on those points, and you'll breathe in this position slowly. Now look at the bottom of the foot. Now those two little yellow kidney-shaped images that's where the kidney reflex is. Now just above those points, there's a little green circle, and that indicates the adrenals. And the adrenals have an intimate relationship with the kidney and bladder, which is part of the reason why we're integrating this stretch into your exercise system, is to calm that organ down. So once you're seated with your legs stretched out the long ways, you'll start with tapping those bladder points on the inner part of the eyebrows, breathing again very slow through your nasal passages down into your diaphragm and filling up your ribs before going down to the kidney points. There again, you'll do one slow diaphragmatic breath, and then you'll start tracing the meridian pathways down the chest, the abdomen, inner thigh, outer part of the calf, make a circle around each ankle, and then there I am at the bottom. If you can keep your legs straight while you're in this position, that'd be great. If you can't, keep them bent. Take 3 slow nasal diaphragmatic breaths, releasing and relaxing and never forcing this action. You'll follow the same lines backwards, and then you'll go all the way up, and then you'll repeat the same tapping and meridian line flowing pattern, because what you're doing is we're trying to create energy that's been blocked at these meridian points to get the energy to flow through the meridians, which will affect your tissues. So it has a integrated effect on the muscle tissues. There again, sliding it down, flowing the water to the bottom of the feet, finding those reflex points, and while in this position, you're breathing slow through the nasal passages, very deep, especially into the floating ribs or the ribs that are behind you, so you can massage the kidney and bladder organs. After you've done your 3 breaths, then you trace it back, repeating for 3 repetitions. So those are a couple of examples of working in. So it's low profile. There's other exercises, but I don't want to belabor that point. Now let's look at a few stability exercises. So now we're working again, we're still in phase 1A, stage 1 motor learning, but now we're going to start. Now again, I don't want to, I don't want to get off on too many tangents, but I'm already integrating mobility and flexibility a little bit, some foam rolling, send them out to a body worker for some other soft tissue work. So I haven't forgot about that, because that's right at the beginning. I need to regain joint range of motion and lengthen those muscles that are short and tight. But let's get into some of the inner core stabilization exercises. Okay, ascending proprioception involves sensory information such as the position of your limbs. You got to be able to move, even if you're on your back, especially when you're up, but you have to be able to move your limbs, and your inner core has to work autonomously in the long run. So that inner core muscle has to activate, remain in activation as you move either your arms or your legs. All right, in this exercise, I'm going to be moving the limb, one limb at a time. And because this is a beginner series for this, and I'll explain the rest in the video. Oh, I also want to mention the towel roll. Some of these videos, I had a little towel roll under my back. That's there for a particular reason too. That's biofeedback. We want to train the lower back in its natural curve. I don't want to unlearn that curve. There's a science behind that. So if you see that towel roll underneath my low back, I implement that only for a couple, 3, 4, 5 sessions, and then I take it out because I don't want them to become reliant on it. That's biofeedback. It's sort of like training wheels on a bike. I eventually want to take the training wheels off, but that's to learn to keep their back in a certain position, but it gives them feedback so that they can feel it because they can't see it. And that's another thing about what I do with a lot of the phase 1 exercises is I heighten your proprioception and your kinesthetic awareness. The best. So now let me demonstrate this exercise. Some of you may not need the towel roll. You might just be using your hand, or you might be doing it without either. Once your towel roll is in position, keep your heels fairly close to your glutes. That's the beginner position. There will be no movement through the knee. My core is off, meaning that as I lower the leg, I'm not going to extend the knee. I'm just going to lower the heel right back where it started. Once the leg is elevated, your thigh is vertical to the ground, your toe is pulled back, your foot is in what they call dorsiflexion. I want you to use that expiration, activate the core, feel the pressure on the towel roll. There should be no movement through this part of your core as you lower the heel down. Then you relax the core, bring the other one up, forced expiration, and just lower slowly with control. Okay, let me repeat. So my core is off. I'm going to elevate the leg in this position. Okay, the ankle's down, the foot's in dorsiflexion. I'm going to gently activate the core. Let's say I'm not using the forced expiration. I have the light pressure on the towel roll, and I control my back from moving off the towel roll as I lower my load, because remember this is actually resistance now. As you lower your load to the floor, there should be no movement in your back. But by the time you get up the ladder here and we start increasing resistance, now the core is on full, what I call full time. All right, now that you have completed the inner core stabilization exercises, ICS-2, beginner, intermediate, and if you were progressed to advanced, now we're going to start really progressing this exercise into what is called the ICS-2B beginner. Now in this exercise, you're going to be what I call fully loaded. In the previous exercise, one foot was on the floor while one leg was moving, and then we would switch to the other leg. That one would move while the opposite one was on the floor. So that's a partially loaded exercise, and what I mean by load is that your leg weighs 10% of your body weight, one leg does. So you're using resistance to use your inner core stabilizers to counteract any movement to the back as you were lifting and lowering your foot from the floor. In this exercise, both feet are going to be off the floor, and then you're going to lower one, bring it back up, while the other one is being maintained in that upward position or in a lifted position. So the main key for the beginner position is that the heels are actually closer to the floor, so that will allow you a little less range of motion to travel as you lower one heel to the floor at a time. If it is challenging to go to a fully loaded position like this exercise offers, and you're having trouble maintaining that light pressure on the towel roll as you're lowering your heel to the floor, then just go down as far as you can, bring the leg back up, and then switch sides. And eventually you'll be able to go all the way down, touch the heel to the floor, and then back up. Remember, the purpose of the exercise is to allow the hip to move so that the heel lowers to the floor without letting the back move. And here again, you're still using your small towel roll as biofeedback, and eventually you won't need that any longer. But as we transition to fully loaded and we advance this exercise, we're going to use that towel roll a little bit longer unless I have suggested otherwise for you. So let's take a look at ICS-2B beginner. So you can see I have my towel roll laid out, but I left a little bit unrolled. Now to determine how much of a towel roll or how rolled up it's going to be is going to be based on what I found during their postural assessment. Now their spinal curve measurement was taken, and for someone who has a lower cross syndrome, they're going to need less of a roll. Compared to the flat back, number one, they're going to need more of a roll. And again, this is only used temporarily, using it as biofeedback and to enhance the client's proprioceptive awareness. Now this awareness, if you will, allows the client to feel the position because they can't see it. And that, what they're doing there is they're building up the memory. They're maintaining the natural curve of their back. So once we remove the towel roll, that memory is built in. You've strengthened the muscles in that particular position. Hence, depending on how thick or how thin the towel roll is, and then we'll progress them away from the floor and they'll have that memory built in. So when I say keep your back in neutral, they'll know what that is. So neutral spine is represented in this image here. This is ideal posture, the normal curve of your low back. I will teach you where that needs to be because it's all based on the curve of your low back. Some people have a flat back, so they need more of a curve to reestablish that curve in their low back. Some people have too much of an arch, and therefore we use even less of the towel roll. Whatever's left over, that's up towards the head. All right, so once we're in position, you know where to put the towel roll now. You've been working with me long enough. You're going to simply activate the core gently. Remember to relax the chest and the neck muscles as much as you can. Let's bring it up into the fully loaded position. Notice how close the heels are to the floor. I would keep your feet and your ankles in dorsiflexion. Just pull your toes up towards your shin. And I want you to keep your thighs vertical to the ground as you perform this exercise. And move at the tempo that's indicated on your exercise system. Tongues on the roof of the mouth. Keep your chin slightly tucked unless otherwise suggested by me. And again, you're allowing your stabilizers to do the work so there's no movement in your back as you're moving your heel to the floor. Now, it's a lot harder to keep your back in position to do this exercise compared to the previous exercise. So you see the level of difficulty goes up, but we can't always keep doing exercises on your back. We got to get you up off of your back and learning how to use your core on what I call a 6-point position. Now that you have completed some of the exercises for the inner core on your back, it's time to start learning how to integrate the inner core from a different position. Your core activates differently in different body positions. So if you're lying on your back, it works one way. If you roll over onto your stomach or you get up on your hands and knees, it works differently. If you go to your knees, or if you get into a half kneeling stance, all the way up to symmetrical and split stance standing, the core works different in different positions. So what we're going to do now with the 6-point inner core stability exercise is begin to train your brain how to control your back, which you did in ICS1, inner core stability number 1, beginner or advanced. You were learning to activate your core while maintaining a little bit of a curve in your back. You were learning how to effectively breathe into your diaphragm, and then you were learning how to activate your inner core and still continue to breathe behind the shield. That part, the breathing behind the shield, now we're going to start adding more elements of resistance or isometrics to help that muscle get even stronger. Breathing behind the shield. Once your core is on, you now are able to breathe. You may not be able to breathe as deep. You may use pursed lip breathing like I've demonstrated. You may just be breathing slowly in and out of your nose. But you're learning to maintain core stability with breath. In this exercise, it's going to challenge you because you will not have any sense of feedback because you're not on your back no longer. This becomes a kinesthetic awareness exercise. And again, what we're doing with the sensory motor system is we're reprogramming it, because if you're starting with me and you have done, and you're in the middle of the first parts of the inner core stability exercises, that means that your inner core either was weak or it was completely inhibited, which is called sensory motor amnesia. This exercise has also been referred to as the horse stance tummy vacuum. What you're going to do is you're simply going to take a deep diaphragmatic breath 3-dimensionally, and then as you exhale, use pursed lips as you draw your belly button up towards your spine. And this is where it'll stay. Mine's still up there. I'm able to talk while I do this because I'm using air. Just like if I were exercising and I needed to keep my core on, but yet do one rep after another, I can keep breathing. I'm just going to have to breathe a little bit more shallow. And that's what you'll do. You'll breathe in and out shallow, just like you did for the 4 breaths on when you were doing ICS1. So as you exhale and you pull your belly button up towards your spine, what you're initially doing is you're working that inner core muscle against gravity. And inside your middle of your cylinder there, as for example, your large and small intestine. Now your large and small intestine together weigh about 7 to 10 pounds depending on the size of the person. Now that's not counting your liver, gallbladder that sits in there as well. So as you're pulling and drawing that belly button in, you're creating that tension. You're using your transverse abdominis like a belt. And you're having to pull that weight against gravity, hold it up there for the amount of time under tension that's indicated on your corrective therapeutic exercise system. So some of my clients might be holding it up there for 5 or 10 seconds, and that's building up some static strength and building that muscle now against gravity, but you have no feedback. So now you're on your hands and knees and you're not lying on your back, and that increases the proprioception of the exercise, which regulates both posture and stability. So we keep transitioning, we keep increasing the level of difficulty, and now we're going to decrease your base of support. We're going to put more demand on your balance, stabilizers, your reflexes, and your endurance. This is still phase 1B. We've transitioned out of phase 1A. Now we're getting into phase 1B. The exercises are definitely stage 2 motor learning.
There should be no movement in the back when you do this. In other words,
remember how I talked about stability is when your spine isn't moving, and core strengthening is when your spine is moving. So core strengthening versus core stability. This is core stability. You're still drawing the belly button up. You got to keep it up there, but watch what I do. And that little tennis ball, watch how I use that.
You're simply going to lift one hand and the opposite knee off the floor, just barely off the floor. And there you'll hold that position for either 10 seconds or 10 slow breaths.
So there again, time under tension. So that those inner core muscles like a lot of oxygen, they like a lot of reps. Number 2, I've been teaching you all the way along, you're working with me, how to be able to breathe and keep your core on, because that's what you're going to have to do when you get to any kind of resistance training, right? Again, for those clients that have just daily activity, I don't spend too much time with the breathing behind the shield technique. I spend a little bit of time there. But anybody that wants to get back into fitness, I want to emphasize on this, because when they get back to full-fledged working out, they have to be able to know how to breathe and maintain core stability all at the same time.
So then you switch sides, and then you alternate from side to side. And because you're holding your core in, like you did for your 6-point ICS exercise.
The video I just showed you, this is the next step.
For teaching your inner core was to be able to contract without rest. Now you're going to activate the inner core, but you're going to impose a bit of instability because you're raising one hand and the opposite knee, which
decreases your base of support. Now there's reflex activation going on here. Those are called your righting reflexes. So let's say you're walking, ever see somebody walk, like they're walking down the sidewalk and they trip, but they catch themselves? That's a righting reflex. Versus a tilting reflex, when I came out of retirement and went back to skateboarding, well, the skateboard moves underneath me. That's a tilting reflex. So I did 6 months of tilting reflex training to get my nervous system back into reflex activation.
So it's a reaction, and you're countering the reaction.
And the tennis ball is biofeedback.
Ball come off your back. If you really want to get precise, then I would put it right against the skin of your back. That way, the material won't get in the way.
So what I'd like to address last are the 7 basic movement patterns. Now in phase 1B, I start transitioning you away from the floor more. So now you're going to get to symmetrical kneeling and half kneeling. And there's a number of different exercises that I use for either core strength or stability. And then we migrate you up into base conditioning training, which is phase 2A and B. Now you're fully in stage 2, working your way into stage 3 motor learning. And these 7 basic movement patterns are our first priority as far as restoring movement competency. Because before you get back to anything else you need to do, or you want to do rather, maybe you want to get back to tennis, golf, fitness, and maybe higher levels of recreation and sports, or if your job is highly functional and you need strength and function for your job, we first got to master the basic movement patterns. And these are the movement patterns that we use in everyday life. Now, I mentioned this earlier in the video, but you could see by these patterns, how would you use a squat pattern every day? I think you know that. A lunge pattern, you may go down to one knee to tie your shoe, or you may have to go over something, traverse over an object. Pushing, maybe pushing a grocery cart, pulling a grocery cart, or a wheelbarrow. The bending pattern, to bend over and pick up an object, or maybe tie your shoes. The twisting pattern maybe represents backing out of a parking space. And then gait is pretty obvious. We want to get you back to walking, and then from there you can vary it up to jogging and sprinting. Now, one of the first patterns I start addressing is the bend pattern, because we got to be able to bend every day in life, and the bend pattern precedes the squat, and I'll show you what that means here. So we got to start teaching you how to hinge, because we're going to start thinking about squatting here. So here's your bend pattern.
And then the other thing is upright posture, chin position. You notice where my hand is. Now you can use your hand, because the front hand is checking your inner core to make sure it's on, if you will. But the back hand is also monitoring you to make sure you're not coming out of neutral. See, like I just came out of neutral. Right?
And when you're learning, somebody says, well, I got to get back in and out of my car. I want to be able to get out of a chair and any other kind of bending position, squatting, if you will. As I was explaining earlier here,
when we squat, what's the first movement that's going to happen? It's going to be a hip hinge, and then it's a knee bend. That's all a squat is. It's a simple hip hinge, but where the hips go, they go back, and then we just bend the knees. There's a couple other things that need to go in there as far as your knee position, foot position. But my point is, the bend precedes the squat, so we teach the bend first.
So we start with kneeling and we get to standing. Now here I'm going to be teaching it to my mentoring student here, my client.
My hand here across my belly button and across my lumbar. I draw in, and what I'm going to do is I'm going to push my hips back and hinge, hold, then come back up. Now I'm going to do one wrong here. You see what happened? So now you're taking what you've done with your inner core work and your hip lifts, and you're teaching yourself to move your hips but not your core. Hip low back disassociation. Hold once you're in the hinge position. Right there. 1,000, 2,000, 3.
Now in phase 1, I do have my clients holding certain positions for so many seconds. In this case, I was having him hold this forward bend position for 3 seconds. Now the purpose for that is kind of complicated, but these muscle fibers, these stabilizers, I should say. So what we're doing here is we're working his postural stabilization system, while at the same time his inner core is firing and maintaining good spinal stability. These muscle fibers are what they call a phasic muscle fiber, and they respond more to high repetitions or extended holds, what they call time under tension. Your postural stabilizers in your inner core, they twitch slow, and we want them to be able to respond all day long. So they need endurance. They require more oxygen to build endurance in those muscles. Now, as we transition into phase 2, I'm only going to provide a few examples. I mean, there are a lot of different examples. It's all based on, what I'm restoring and what the long-term dream is of the client. But I want to show you some basic movement pattern examples in phase 2, and then I will do a little brief overview of phase 3. And what I did is I slowed down the video footage so you can see what I do when I'm teaching. So here is a bend pattern with a pull pattern combined. And what I'm teaching my client is you have to hinge without rounding your back. So everything I was teaching my client in phase 1 now carries over more into a dynamic posture, maintaining this good, postural position as I teach the bend pattern combined with the pull pattern. So from the breathing that I teach my clients to how to move their limbs or their body while maintaining good posture, all that starts to carry over into phase 2. And then when we get up into a split stance, now your base of support is narrow. So here's a pull and a push while maintaining core stability because your back isn't moving. And then we start learning the squat pattern. Here's what we call a Jefferson squat. Again, she's hinging perfectly, her breathing's in play, her inner core is doing exactly what I taught her to do in phase 1A and 1B. So again, remember, this is base conditioning now. And then from a squat pattern, we have to be able to lunge. Even if we're going to lunge down to tie our shoe, we have to be able to lunge. Now here's a dynamic lunge, and I'm stepping back as I'm lunging here. So this takes a lot more proprioception. This is more of a phase 2B exercise as I start challenging my client in a position where they can't see where they're moving and they have to maintain all these postural positions I mentioned. And this is something unique. This is my 69-year-old who came to me with chronic left knee and hip pain. She had it on and off for 10 years. Now she's cleared everything by this point, but I wanted to use this video to show you that I work with a number of different people at different ages. This is a push pattern. Now again, remember, this is a 69-year-old female that came to me with chronic left hip and knee pain, which is gone by that point. Now we move into more dynamic push pattern with a twist. So here I'm combining a twist with a push, and there's a weight shift involved. And again, now we start looking at the beginnings of the transition into phase 3. So here now my client's learning how to do the push pattern, and he's now well into 2B. He's cleared. This gentleman was the man that came to me with the chronic shoulder, low back, heel pain, knee pain, and this is 2025. This is the first summer in 3 years he was able to get back to regular functional training. Now again, it doesn't matter what your age is. We all have to be able to primarily have the 7 basic movement patterns down pat for everyday life. But if you have goals to get back to work-related strength, daily activity-related strength, fitness, all the way up into sports performance, some of you may transition into phase 3 and B. Now, depending on your long-term dream, maybe you want to get back to golf, tennis, pickleball, maybe rock climbing, mountain biking, cycling, or you may be a semi-professional athlete, or maybe an occupational athlete, firefighter, nurse, EMT, law enforcement. All the way up the ladder, we need to get you work hardening so that you can not only enjoy your sport, recreation, or occupation, but again, we can't forget about the daily strength and endurance that's needed for everyday life activities. By the time you get to this phase, now we start really loading you and really doing things that are more specific to your dream. And you're going to see these basic movement patterns are in play. Now here's me at age 56. Remember, I had the bulging disc. They said I'd never squat. And there I just squatted 235 pounds with no weight belt. But just to show you, this is what phase 3 is all about. Now we really start applying the external resistance, the intensities, and all the other what we call exercise variables to help meet the demands that you have for your dream. Okay, again, these are just examples, but we have a squat pattern and we got a pull pattern. And okay, here's my bend pattern, age 55, no weight belt, and that's a 220-pound conventional deadlift for some reps. But here's my, that's actually could be considered a pull and a bend combined. You know, you got to pick things up from the ground, sometimes repetitively. Now this is a push pattern I don't do too much of anymore. I usually push horizontally as opposed to vertically. But just to give you an example, here's the push pattern. And from more of a high intensity interval training perspective, here is me doing an interval training routine for muscular endurance, where I have the client perform 8 exercises. Now each exercise is done at a maximal effort for 20 seconds, and they take a 10-second break, and they usually go through about 3 to 4 rounds of that. All right, so those are just some ideas of what I do when I get up to phase 3. All right, so as I conclude my presentational series, I want to first thank everybody for sticking it out with me through an extended series on a topic I think is vitally important. Let's just do a quick recap to cover what we learned. Number 1, it's not a back problem. It's a body problem. And it doesn't matter if you have low back pain, neck pain, any kind of pain, this approach will work. The statistics don't lie. And after following this for the last more than 2 decades, working in the industry, working from the clinical end and the private end, I've seen these numbers continually rise, and it always perplexed me. All these clients that had challenges nobody could figure out. So 90% of lower back pain cases are considered non-specific. So they're idiopathic. We have all this technology, especially now, all the promises that are being made, all the gadgets and the gizmos, and I'm not saying that they don't work, but you can't just use one approach. And if we get to the cause, we don't need a lot of technology and gadgets to feel and stay well. I know I didn't, because remember, I had lower back pain. I had a bulging disc. And still am maintaining my digestive system. Cervical issues, concussions from my sports and before. I tried a lot of things at the beginning. And, everything from ultrasound to electrical stim to physical therapy to chiropractic to anti-inflammatory medications, traction. But it wasn't until the late 90s where I began to really look at what was really missing. And that was this. This is the key. Aristotle said the whole is greater than the sum of its parts. That we can't just work on parts of the body. Remember how I said they sliced it up? You go to a shoulder specialist, you go to a back specialist, you go to a knee specialist, you go to a gastrointestinal specialist, etc. Well, what did we learn about the human body? That it's integrated. You can't carve it up. You can work on a system. All right, we're going to work on your back. And your back gets better, like mine did. But later on, it got worse. My clients, on and off pain, 3 years, 5 years, 7 years, 12 years, 18 years, carving it up, not looking at the whole. But the body is a multidimensional system of systems, and it's dependent on one another to function. Holistic, treating it without drugs. There are lots of ways to mitigate inflammation and pain without drugs. But using what God has given us, the human body has the ability to heal itself. What gets in the way? We do. We do. What did you learn from this presentation? You learned that there are 4 major stressors that contribute to this. This is what I found in myself and my patients and clients. How are you managing your day-to-day stressors? Are they accumulating? Are they part of the challenge? They are. Do they affect the key stabilizers in your back? You learn that in this. Where else have you learned about that going to a seminar on back pain? Did they assess your breathing? Are they teaching you to regulate your system and get you into more of a yin parasympathetic, which is cooling, restorative repair, and getting you out of the sympathetic yang, fire, breakdown, catabolic, just by teaching you how to breathe, which has all kinds of other benefits besides just reducing your stress. Remember, your diaphragm is a spine stabilizer. Pre-sleep hygiene. If you're not getting a good night's sleep, look at what happens between 10 p.m. and 2 a.m. Do you need to have physical repair? Is that part of your plan with getting out of pain? Are you going to a physical therapist? They're doing passive and active therapy. Are you going to a chiropractor? Most of them just do passive therapy. Are they asking you about your sleep? Are they trying to mitigate that? Because with active therapy, you're going to be breaking down tissues so that you can rebuild stronger and more healthy tissues. But they need sleep. That repair cycle. And then let alone between 2 a.m. and 6 a.m., that's when your mind is rebuilding, if you will. So here's a good anabolic, circadian rhythm, homeostasis, in balance. Here's a natural yang waking with natural cortisol in the morning, how I wake up now. And then as I go through my day, my yang comes down and I start to nurture my yin so I can prepare for sleep. I've given you a lot of recommendations on how to get a better night's sleep. But what are we putting in our body to fuel it? And what have we learned about nutrition? And what does poor digestion do to your stabilizers? They turn them off. And I shared with you exactly how that works. And organs and your visceral system. Here's your viscera. Here's your core stabilizers. Your viscera gets overheated. It puts energy, it dumps the excess energy into the tissues that surround that organ. And it can create all kinds of problems with that tissue. It can get short and tight. So hence people's rib cages and their middle of their trunk is splinted because it's trying to protect you because your inner core stabilizers are turned off. Do you have the right raw materials? Would you put diesel fuel in a gasoline engine? I don't think so. So what are we putting in our body? And the very first thing besides breath is water. Survival, right? So you got to breathe to survive, and you got to drink, and you got to eat. Well, if you got to repair your back, you need proper hydration. And not just drinking any type of water. Anybody can tell you to drink more water. And hell, then people just tell me, all I do is I pee more. Well, yeah, because you're not hydrating the water. There's one benefit to peeing more, what I call purifying. Well, look at the word. If you're urinating more, that means you're purifying more. The best solution to pollution is dilution. But if you're putting the wrong raw materials in you, dirty water, unstructured water, not mineralized, it's no good to the body. The body will get rid of it. Doesn't want it, just like food. You eat the wrong kind of food, what kind of reaction do you get? Belching, diarrhea. Some people even vomit if they get food poisoning. Your body's trying to eliminate it. That's a detoxification response. But what we're talking about here is rebuilding your tissues. Lifestyle factors have everything to do with your pain. We just covered that. If you're not assessing, you're guessing. Sure, you've had your posture checked. Sure, some of you have had your range of motion checked to check for movement restrictions. But how many people have had their core assessed? Number 3, and not just any part of your core, your inner core. Surprise, surprise. So the body knows nothing of muscles, only movement. You have to restore the body, the movement system, and not just one part of it, because it's all interconnected. What kind of spinal condition do you have? What kind of spinal curve do you have? Do you have too much of a curve? Remember, you don't want to guess. You got to know. I had to know. I measure it, and if I'm in doubt, I refer them out and get a second opinion from a good practitioner, like I did for my client here in Jacksonville. And we found all kinds of discrepancies in his x-rays. But I was able to confirm that he was actually a lower cross syndrome, which requires a different kind of a corrective therapeutic exercise strategy. But thank God he didn't have a spinal condition, but I needed to rule it out. Remember, he was in constant pain. I wanted to rule out and make sure he doesn't have any of this stuff, because that changes the strategy, or I have to do more refer him out for those circumstances. Although he ended up working with a body worker and a chiropractor, and then me. And it doesn't matter if you don't have pain. I threw this in as a bonus. Remember the study? 76% in a group that had no pain. They had MRIs just like the people with pain. And they found that the people that didn't have pain had etiologies. They had the startings of some sort of a disc herniation. May not have been a grade 4 or grade 5, but they had 1 and 2s and 3s. All right, you learned about the difference between core strength and core stability, and what precedes what. Right? You got to have a stable core before you move around on it. So if you're moving the spine as you're exercising, say I'm rotating, if I'm doing an exercise for core strengthening, that's what it takes. But if I'm sitting here on this stability ball, which I am, and I raise 1 foot off the ground, I can't let my spine move. That's core stability. But how many of you had your inner core assessed? Remember the numbers I showed you? No one that I saw, both clinically and privately, no one that came to me, whether they had pain or not, had their inner core assessed. Did you know you have an outer and an inner core? You learn that. And you learn the value of your inner core. It's different. It operates differently than your outer core. Your outer core does stabilize your back. I get it. But it's not your first responder. Your first responder is here. Diaphragm, transverse abdominis, pelvic floor, multifidi. You got a spinal condition. This is what's not working. It's not working. But your outer core is fine. I see a lot of people with good outer core muscles, but they still got back pain. This system is offline. And we use the word offline because the body is a cybernetic bioelectric magnetic organism, an integrated multidimensional system of systems. You learn that the body's electric. That's new to everybody. Everybody just looks at the body as cells, muscle tissues, blood, lymph. Yeah, that's important. But your underlying operating system is all electrical. That's how all those systems work. So I literally am rebooting your system to get those inner core muscles back online. And every time you do the exercise, what are we doing? We're writing new software. Cells that fire together, wire together. Then, if you're not doing the right exercise at the right time, you might be doing you more harm than good. Because, like a medication, there could be contraindications, there could be side effects. Well, there are plenty of side effects to exercise. Just ask my client here in Jacksonville who was okay to go back to the gym and he went right back into pain. And there is a progression. We have to get you loose where you're tight, and we got to get you stable where you're weak. Then we get your strength and power. You know, if you're looking at a pyramid, so the performance pyramid, let's say you want to get back to tennis, golf, mountain biking, rock climbing, you're a construction worker, you're a firefighter, you're in the military, or you have 15 kids. You want to get back to skill, look at the base on this pyramid. You have to have that base solid. Otherwise, as you go up the ladder, if this pyramid at the bottom was short and these were long, it would tilt from side to side. You wouldn't have a solid base of support. But we went one step further. Look at what it says here. Phase 1 subbase, then your base. So I build it wide first. That's your subbase. That takes care of spinal stability, circuitry, calming the system down. Then you can go off and play on it. And then there are the phases. And again, if you skip phases and you go back to sports too quick, you go back to your work activity too quick, your daily activities too quick, you end up where my clients ended up. They ended up back in the clinic because the system that they followed before left out key areas. If you're building a house and you leave out key materials while you're building your base, and you keep building on top of it. You build the walls, you put the dry wall up, and then you put the roof on. That's a lot of load, isn't it? If you skip steps as you're building the frame, what's going to happen? It's going to start crumbling. So you don't skip phases. They skipped phases when they built our house where we lived. And our house was fine until we got rain. And then we started having seepage in the basement. And the seepage turned into a flood. And what we found out is they didn't do a good job curing that cement long enough before they kept working on top of it. So we had to dig out all the lawn and all the dirt around the house, and we had to go down next to that cement wall, because this is back when we had basements up north, and we had to cure that cement. My dad invested a lot of money in that house. He wasn't going to just junk it. He had to dig everything out and repair it. So the guys that built it the wrong way, they paid for it. Well, so when people come back to me and steps were skipped, I got to go back and rework it because I still want them to get to your dream. Remember, what's your anchor? Your anchor is, if you weren't in pain, what would you be doing? What would you like to be doing? Fill in the blank. Doesn't matter. I don't care if you're 70 years old, you're 80 years old, or if you're 30 years old, or you're 16. What's your dream? If I skip stages, I'm preventing you from safely achieving your dream. And again, going back to movement as medicine, at the beginning, when you're all wound up, you're in pain, your nervous system is cranked up, the exercises have to be mindful with breath. They still have to be restorative, but I can't be jacking up your nervous system, because otherwise you take 2 steps forward and 15 steps back. You want to earn your rite of passage to working out. Working in is yin, cooling, restorative, repair, right? Anabolic. Working out is yang, fire, catabolic, to break down. And everybody's got to have their 7 basic movement patterns to be ideal. Because until you play tennis, before you get to phase 3, these patterns have to be ideal. If you can't bend, pull, push, lunge, squat, twist, or have a decent gait, then you have no right to be loading it up like I'm doing it down here. If I don't have a basic bend pattern, then I can't basically bend over and pick up 245 pounds. I have no right to be doing that. I could skip stages and try it anyway, though. No, so this is survival. So in order to survive in the wild, which is what we have out there in real life, you got to be able to breathe to survive. You have to have water to survive. You have to have food. And then you have to be able to provide for your family. And that takes physical effort for most of us. So that means you got to be able to squat, lunge, push, pull, bend, twist, and walk, run, or later sprint in order just to meet the standards. All right. So I'm Brian Schwager. I thoroughly enjoyed sharing this. Remember, the purpose of this is knowledge and education. But if you do have questions and you would like to learn more, my contact information will follow. Please follow me on Rumble if you'd like to learn more about some fascinating information when it comes to the body, improving your wellness, improving your movement. I have a series right now that'll blow you away called The Next Evolution in the Wellness and Movement Industry. Start from 1 if you really want to learn about what's happening with our health and well-being on the planet. But along the way, I give you a lot of solutions. And that's the last thing. Yes, there is some information that's hard for my clients to hear, but I'm always upfront and honest. But I always have a plan. You take it one day at a time. The journey of 1,000 miles starts with 1 step, says Lao Tzu. And keep your faith. All right. Follow me on Rumble. Follow me on my Facebook page for Wellness Movement Services. Follow me on my Facebook page. And most importantly, live with passion. I'm Brian Schwager. Be well. Bye for now.